Welcome to Locally Sourced. I'm Armanda Famiglietti. Healthcare. It's a necessity for sure, and some people think it's a right. The U.S. is the only developed country that doesn't provide quality healthcare to all its citizens. However, there is a bill heading to the New York Senate that would provide comprehensive healthcare for all New Yorkers. Want to know more? My guest knows all about it. She's a medical doctor, an educator, and a passionate advocate. Welcome, Dr. Elizabeth Rosenthal.
I'm very glad to be here this morning.
Dr. Rosenthal serves on the board of the New York Metro chapter of Physicians for a National Health Program and is on the volunteer faculty of the Albert Einstein College of Medicine. She's a graduate of Smith College and NYU School of Medicine and has written and spoken widely on the subject of healthcare reform. So, Dr. Rosenthal, how did you get interested in health reform and in this organization, the Physicians for a National Health Program?
Well, I've been a doctor for 50 years, just had my 50th reunion, and I've seen all the changes in medical practice over the years that I was working as a doctor, and even before that, because my father was a doctor and my grandfather was a doctor. And I didn't like what was happening. I saw that more and more I had to spend time, instead of spending time with my patients, I had to spend time fighting with insurance companies to get paid. I had lots of patients who couldn't afford to come to see me. I had elderly patients who had to choose between taking their medicine or paying their rent. And it was very upsetting. And the more I observed these things, the more I wanted to find out why and how that happened and what we could do about it. And that's how I found Physicians for a National Health Program, because they were advocating for many years before I joined them for a single-payer Medicare for all system for our country. Mm-hmm. I mean, I came to believe that it's a crime and a disgrace and a shame that our rich country can't provide health care for all its citizens. Every other industrialized country does the same. And people in this country are badly misinformed about the whole situation. Mm-hmm. They think that everybody in other countries is running here for their health care because we've got the best and the brightest and the newest and the latest. And it's not true. It's just not true at all. And we don't have the best care in the world. Some people in this country do, but some people don't have any care. Mm-hmm. The inequities are disgraceful.
So as I understand it, and I'm trying to be educated on this subject, Americans pay the most for their health care of all the developed countries.
Absolutely right.
But the quality of the care and the outcomes of the care aren't as good as these other developed countries that do provide health care for all of their citizens.
That's correct.
Okay. So actually we have some slides that demonstrate and illustrate for us what these inequities are, right? So this is compared to other countries. It's on the screen. Right. This is life expectancy. So, you know, that's a pretty straightforward indicator.
Right. The U.S. is on the left, and you see in the yellow.
In the yellow.
Has the lowest life expectancy.
Compared to all of those other countries, so Germany, the UK, actually I'm having trouble.
Canada,
Japan. Why is
Australia.
that?
Okay. Well, one of the reasons is that we don't provide care equally to all our citizens. So people who are poor. Mm-hmm. Don't get as good care. And there's other reasons why they don't have as good health, because they're poor and they work harder and they have less, their food isn't as good, and all kinds of reasons. But health care is definitely one of them. Mm-hmm. And the other reason is that so it's not equitably distributed. So some people in this country have a very good life expectancy, but even there was a recent study that showed, depending upon your zip code, your life expectancy can vary greatly by 10 years.
Wow. So there's another slide that we have, again, comparing the United States to other countries. That's going to appear in a minute. Maternal mortality.
Yeah, it's very shameful that we have such a high rate of maternal mortality.
Now, that is shocking. So the yellow bar is so much higher than those other developed countries. How can that be?
Well, again, a lot of it has to do with the poor people, but it's just, and a lot of people do not have access to care. It's hard for them to find a doctor. It's expensive for them to find a doctor, so they go without care. And if you go without care during a pregnancy, it can make the maternal mortality much higher.
Horrible. And here's another slide about infant mortality.
Mortality is higher as well.
Now that's pathetic. That is outrageous, actually. Again, the United States
it's not because we have fewer doctor visits. It's not because the price isn't. The price is very, very high, and that's not because we have fewer doctor visits. No, that's not what I'm going to say.
Well, let's look at this chart. So you can see now the bar is very small, meaning that
we don't go to the doctor as much as other
Right, so we don't go to the doctor as much, although it seems like we're going to the doctor all the time.
No,
Japan is leading us by far, and so I'm going to guess that these limited doctor visits, again, have to do with access. It has to do with price. It has to do with what insurance covers and what it doesn't.
Exactly.
I know some procedures you have to ask the insurance company first if they will cover it, and they don't always do it. And now this is a shocking slide up here, but it's happening all the time,
and there's something
right?
that most people don't realize. 2/3 of bankruptcies in this country are due in whole or in part to medical debt. That's why that number, that's why you see that number there. But also, most people don't realize that 3/4 of the people who were bankrupted by medical debt had insurance at the time of their illness, because they're underinsured. That's even as big a problem as not being insured, as being underinsured. Okay. So you can't afford to use your insurance because it's so expensive. You have such a high deductible. And it's so expensive when you actually do visit the doctor, even with your insurance, because of the copays.
So we have another slide up, and it says it doesn't have to be this way. And again, it's showing every country but the United States in this slide. So I'm going to assume that if the United
States is the outlier in the black, and the other countries bunched together are all the developed countries.
Oh, and really? I thought it said France on the top. But anyway,
no, that's the price. That's the money that we spend on healthcare in our country. So it used to be the same as the other countries. They all got national health insurance, and we didn't. And that's when we started parting ways, and our prices kept going up much faster than theirs.
Okay. So you're saying that healthcare is enormously expensive. It's hard to access. Why is it so expensive? Why is it so expensive for businesses that have to pick up the healthcare insurance costs for their employees?
The main reason why it's so expensive is it's the prices. And in this country...
Is it prescription prices?
Well, everything. The prices of everything. Doctors can charge whatever they want.
Hospitals can charge whatever they want.
And hospitals can charge whatever. And pharmaceutical companies can charge whatever they want. And they do. And they charge whatever the traffic will bear, and it bears a tremendous amount. We pay more than twice as much as every other country for drugs, and they're made by international corporations sold all over the world, and we pay twice as much.
And they're the same drugs, and that's why some people go to Canada to buy drugs.
Absolutely.
Canada has a national health coverage for all their citizens, and because of that, they're able to negotiate
prices,
with the pharmaceutical companies to bring the prices down for the exact same drugs.
Right.
But because, sorry to interrupt you, as I understand it, because the United States doesn't have that kind of power that having a single payer, one source insurance company, which is really what we're talking about here, only the insurance company is the state of New York instead of all the different insurance companies, that they could negotiate much better deals with the pharmacies and much better deals with all the practitioners.
The VA does that.
Right. Well,
the Veterans Administration, we have single payer systems in this country. We've had Medicare for over 50 years. And Medicare takes care of the sickest people. And prices in Medicare are rising slower than in the private insurance market.
We have the VA, we have Medicare, and we have Medicaid. Right? And Medicaid was extended or expanded under the Obamacare ACA Act. That's correct. And people are now talking at the national level about rescinding the expanded Medicaid, which would mean that millions of people across the nation that have been funded or supported by Medicaid would lose that coverage, and we'd be back where we were
before
at the beginning, before the ACA, when we, and our mortality rates will skyrocket again.
The sickest and most vulnerable people use Medicaid, and
Okay, so let's talk about some good news. Okay. So the good news is that there is a movement in the country. It's state by state, and people are thinking we cannot depend on the federal government to provide us with quality health care. Each state is thinking about providing their citizens with quality health care. And just to let you know that California, Massachusetts, Vermont, Colorado, and of course New York. Did I miss any?
Maine is working on
Maine,
one.
I thought so. They're all in a race, really, to see who can come up with the best health care for their own citizens. No matter what happens in Washington, they want their citizens to be protected. So I mentioned the New York State Health Act, and we're going to talk a lot about that. I have some slides that explains the New York State Health Care Act. So this is what is present. This is current pre-New York.
Despite the Affordable Care Act, we still have a lot of people uninsured.
2 million New Yorkers remain uninsured. That's completely uninsured. So these are people who are under the age of 65.
Right.
And they're probably too quote unquote wealthy to have Medicaid.
Right.
So those are the middle class people who are stuck in the middle, who are the ones who are really devastated by the present lack of health care.
And that doesn't even count all the underinsured people who still don't have access because they have to pay so much out of pocket even though they have insurance that they often don't go to the doctor when they need to.
So now we have a slide up, and this gives us a little more information about the healthcare reform in New York State. And the healthcare has a Senate number. It's Senate 4840. Remember that, 4840, because that's an important number when you talk to your representatives. You want them to support 4840 if you think this is a good idea.
That's right.
So let's get a little into detail now about what exactly this is being proposed.
Okay, it would give health care to everybody who lives in New York State. Very comprehensive benefits, more comprehensive than Medicare and than most people's insurance. Primary and preventive care, inpatient and outpatient, prescription drugs, dental, vision, and hearing care, which is usually not provided with, certainly not with Medicare and not with most insurance companies.
And that can be so expensive.
And long-term care, and you have your free choice of provider. People say Americans want choice. Well, they don't want choice of a plan because the only reason to have more than one plan is you can't afford the good plan, so you have to get a cheaper plan that doesn't cover as much. But this will have the Cadillac plan, and everybody will have the same one, and there'll be no deductibles and no co-pays. Every resident of New York State is in the plan.
Right. So eligibility, it says that every resident in New York State is covered, and that means every resident and everyone who's
documented and undocumented.
That means that if your address is in New York State, you are automatically covered. That's it. End of story. You don't have to do anything else. Cradle to grave. So pregnant women, right through to the elderly, are covered. Now, we mentioned before that there's already some people are getting VA, they're getting Medicaid, they're getting Medicare. How does this affect them?
Well, the funds for Medicare and Medicaid would be folded into the New York Health Trust, and they would get that instead.
Okay. So as I understand it, if you're on Medicare, you get Part A. That just comes with being a citizen and being over 65.
Right.
But there are other parts that you have to pay for, like drugs and
right. Well,
and
you
this
have to
would
pay,
cover them, right?
Yes. Part B pays for doctor's visits and tests and stuff like that. And there's a premium. Everybody pays a premium for that. That you wouldn't have to pay the premium.
The premium goes away.
Right.
So no more supplemental insurance for people over 65 or 65 and older.
Exactly.
Actually, can we just go back to the eligibility slide for a minute, because there were some really important issues there.
So it doesn't matter how old you are, what sex you are, whether you're working, whether you're not working, whether you're rich, whether you're poor, everybody's in.
Right, and it's high quality health care. High quality.
Absolutely.
And no regressive insurance premiums. So insurance premiums go away. And this is very important, I think, that doesn't get enough attention. Businesses, one of the largest costs any business has is covering health insurance for their employees. This means they no longer have to cover health insurance for their employees because the New York Trust is going to do that for them.
There will be a payroll tax.
A payroll tax, right.
Is income tax, and for employers it's a payroll tax, and 80% would be paid by the employer and 20% would be paid by the employee, or if the employee wanted to negotiate that, maybe the employer might pay the whole thing. But it's still a whole lot less than what they're paying now.
It's a whole lot less.
A whole lot less.
Right.
And people would be paying more in their taxes. You have to mention that.
Right.
But it's very progressive, so that if you make $25,000 or less, you're paying nothing. And then it goes up gradually.
Is that per person or a family of 4? 25,000
per person.
Okay.
And if you are wealthy and you make a large income, your prices could actually go up. But boo-hoo, those people can afford it.
So we have the financing slide up there, and as you said, 80% would be the employer and 20% the employee. But if you take those numbers and you put them next to what's being paid now, it's tremendously less, right?
Yes.
So it's a real boon to businesses in New York.
About 98% of New Yorkers would be paying less for health care than they are now.
And then the 2% are the ones who are at the very top of the income level.
Right.
We talked about federal Medicare, Medicaid, CHIP, and ACA funds. And you said that's all going to come together. Now, ACA funds, we do not know yet whether or not the ACA is going to exist in a few months. We're taping this show when we're still waiting for the Senate to come out of the closet and give us some information about what their bill's going to look like. And we don't know if that will ever pass anyways, correct? So the slide that we have on now is sort of a synopsis, a summary of what all the great things about the New York Health Care Act can do for New Yorkers. It's good for jobs. It's a better deal for everyone.
About jobs, one thing that people don't think about all the time is some people have job lock. They're afraid to leave their job because what do you lose when you lose your job? You lose your health insurance. But when it's not connected to employment, you can have a lot more entrepreneurs who are willing to go out and try something new and start a business, and they won't have to worry that they won't be able to have health insurance.
I know, at my age, I know a lot of people who are sticking in their job until they're 65, no matter how much they hate it.
Right.
Because they don't want to pay for the insurance if they lose their job, and it's not good for business. It's not good for them. It's not good for the state or the country. So this sounds like such a great idea, right? It's like a no-brainer. Who is against this?
Well, you can imagine the health insurance industry, the pharmaceutical industry, the medical device industry. Doctors are coming around now. It used to be that...
Well, you're a doctor and you belong to that group that thinks it's a good idea.
60% of doctors are in favor of it. Mm-hmm. The highest earning doctors are the ones who are the least in favor because they're afraid they might earn less money.
Right. Well, you mentioned that groups are coming around, and it seems like every day a new group has decided to take matters into their own hands and say, look, forget about the insurance companies, forget about all of these people who are manipulating the prices and, really making people sicker by their practices than making them well, which is the idea. So we have a slide that actually shows just a few of the groups, and they're pretty impressive, who are signed on to the New York Health Care, right? So we're going to see that slide in a minute. And your group is one of them.
PNHP is a group of doctors with one issue, that is we advocate for single-payer Medicare for all. There's many other doctor groups.
Yeah, can we see that slide of the
faith groups
of the information? Okay, maybe we can't. I don't know. I know that slide's there somewhere.
We have 200 groups that have signed on.
Do you want to just read some off while we're waiting for?
And they're
that's not right. But there's a group of groups that support it.
Okay, so here's a very large list. Many labor
right, and
groups
the teachers
and community groups. In Westchester, there's Westpac. There's tons of people. Westchester for Change.
Right. But all over the state, the nurses, groups. Isn't the Association
nurses
of Nurses
are way ahead of everybody.
Right.
They actually told Assemblyman Gottfried about this 25 years ago when he first, decided to be the champion of this bill. There's all kinds of faith groups. There's
Well, I know the League of Women Voters, AARP,
right.
really big national groups are supporting this, and many medical groups, the nurses, the doctors. So it's fantastic.
Healthcare Now and
right. So I'm hoping that when people see this, they're going to say, I want to know more about this because this sounds too good to be true. So we just a minute ago, I saw a slide that said, if you want more information, these are the organizations you can meet. So the Senate has the bill printed on their website. You can read the whole bill if you just go to the NewYorkSenate.gov legislation bills 2017 and S4840, which is the number of the bill. Campaign for New York Health is a huge organization that's doing a lot of work.
It's promoting this.
And New York Healthcare for All, of course, is doing a lot, and so is yours. But these groups are small compared to the lobbying that's possible when you think about Big Pharma, when you think about the insurance companies who are making so much money off people's suffering, really, and other ways. So these groups need as much information as they can get. So you'll see on the screen that if you really want to make a difference, if you look through the information and you decide this is a good idea, this would be the man to call. He's Senator Terrence Murphy, and he represents most of Putnam County. So we've got his email address and we've got his phone number, and he would be a great person to call or visit. Also, John Flanagan is the New York Senate leader. He's another person you may want to email or call. And
tell him to bring it up for a vote.
Tell him to bring it up for a vote. He's the only one who can do that, right? So John Flanagan is key in this process. And Senator Kemp Hannon is the chair of the Health Care Committee.
And that's where it's stuck. It's stuck in committee now.
It's where many bills go to die is in committee. And this is where all the lobbyists who don't want this to happen for New Yorkers are visiting constantly these people and saying, this is a bad idea. This is going to cost too much. Nobody wants this. It's going to be hard to do. It's not going to be any better than what comes out of the Senate. It's not going to be any better than Obamacare. Right? Is that what they're saying? Don't believe them. You make up your mind yourself, and if you think it's a good idea, get in touch with your senator. Right. We just have a couple of more minutes to go. So what would you say is the most important thing for people to understand? Is it economically feasible? First of all, can this be done without all of our taxes going through the roof?
Okay, absolutely yes, and don't let anybody tell you no. The only people whose taxes are going to go through the roof can afford it. They have many
so some
roofs.
People's taxes are going through the roof?
The wealthiest people are going to have a slight increase in their taxes.
Slight increase, right, not through the roof.
Nothing like what the taxes were when I was young, when the 90% was the marginal tax rate for the richest people. Can you believe that?
Wow.
Yes. And
those were the good old days.
Yeah, that was
Maybe
the good
that's
old
what
days.
Trump means when he says make America great again. Could be. Anyways, so what can I say? Time goes quickly, and we are just about all out of it. So Dr. Rosenthal, Elizabeth Rosenthal, thank you so much for coming on the show and for all the work you do as an advocate. I know you live quite a distance, and you came up to Carmel today just to be on the show and to help people understand this. You know, right before the show, we were talking in the control room about this, and most of the people said, I've never heard of this.
That's the problem.
I never heard of this. So we got to get the word out, and thanks so much for what you do.
It doesn't get in the media.
No.
Single payer.
I wonder why. Anyways, we can have many shows about this. So just to tell people, if you think that this is a good idea, get in touch with your state senator, get in touch with all the senators in the state Senate. And there are many civic groups, sort of grassroots groups, who think this is a terrific idea. They've been protesting, they've been having rallies. Find those groups and really get active. And as always, I want to thank this very hard-working volunteer crew here at Comcast. They do a terrific job. They show up, and I really appreciate them. So, till next time,